Hi everyone, this is Mrs. P.INDHUMATHY, Assistant Professor from the Department of Pharmaceutical Chemistry and Analysis, School of Pharmaceutical Science, Wales Institute of Science, Technology and Advanced Studies from Chennai, India. Today we are going to see a presentation of about SDG 3, that is good health and well-being. SDG 3 is one of the most critical goals in 2030 agenda because of the health is the foundation of everything. Healthy individuals build healthy communities, and it also builds the strong economics also. Today we will explore what is meant by SDG 3 entails and the current progress, the persistent challenges and the crucial role of pharmaceutical industry and healthcare professionals in achieving this ambitious target. By 2030, we aim to ensure that people of all ages have healthy lives and experience of a well-being, not just the absence of diseases, but also true wellness also. So moving on to the next slide. So generally SDG 3 is nothing but ensuring that all people can enjoy healthy lives and well-being regardless of where they are born or their socio-economic status also. Let me break down the five key pillars of this one. First one is it's about ending preventable deaths. Currently, millions of people are dying in each year from various causes. We can prevent through vaccines, medicines, and healthcare also. Second one is we must reduce the global disease burden by controlling their major epidemics like HIV, tuberculosis, and malaria also. Third one, we must achieve universal health coverage, like meaning everyone can access the quality healthcare without facing the financial hardship also. Fourth, we need to address non-communicable diseases like diabetes, heart diseases, and cancer, which are rapidly becoming the leading causes of death worldwide. Finally, we must strengthen health system and health workforce, especially in developing countries. These are the five pillars are interconnected and it must be pursued simultaneously in order to achieve the goal. So, what are the key target of the SDG 3, that is maternal and child health? Let's focus on three critical targets. One is specifically aims to reduce the maternal mortality ratio to less than 70% in 2030. Maternal mortality is a tragedy that disproportionately affects low-income countries. A woman's chance of dying from pregnancy complications is 33 times higher in sub-Saharan Africa than in the high-income countries. The Target 3.2 addresses one of the humanity's greatest achievements, the dramatic reduction in child mortality. We want all countries to reach the neonatal mortality rate of no more than 12% thousand live births and 5 mortality of no more than 25% of 25 per thousand live births. This would have saved approximately 8 million additional lives by 2030. Target 3.3 focus on major infectious disease epidemics like AIDS, tuberculosis, malaria, and neglected tropical diseases also. These diseases collectively affect over 2 billion people globally and contribute to the losses of productive life years. The pharmaceutical industry has been instrumental here and from antiretroviral therapy reducing AIDS deaths to malaria and elimination programs. And target 3.4 is perhaps one of the most challenging because it addresses the non-communicable diseases like heart disease, diabetes, cancer, chronic respiratory diseases. The target is to reduce premature mortality from these diseases by one-third by 2030. Additionally, this target emphasizes the mental health and well-being, which was largely neglected in global health agendas until recently. The COVID-19 pandemic highlighted the critical importance of mental health and we must integrate the mental health services into overall healthcare system. Next target addresses the substance abuse and target 3.6 aims to have the number of deaths and injuries from road traffic accidents by 2020. The target applies to 2020, so we need to assess progress urgently. Let me share some encouraging yet global sobering statistics. First, the global maternal mortality ratio has declined significantly from 228 maternal deaths per 1 lakh live births in 2015 to 197 in 2023. This is progress, but it is not enough. To reach the SDG target of 70 per 1 lakh, we need to prevent nearly 7 lakh more than maternal deaths between 2024 and 2030. The proportion of births attended by skilled health personnel has increased from 80% in 2015 to 87% in 2024. It indicates improvements in access of healthcare during pregnancy and childbirth. The fight against communicable disease presents a mixed picture of success and setback. Let me deal each major infectious disease. On HIV, we have made remarkable progress. AIDS-related deaths have halved in 2010 and dropping from 1.3 million to 6 lakhs 30,000 in 2023. New HIV infections have been increased by 39% in 2020. However, the tragedy remains and the people are living with HIV, but 9.3 million lack life-saving antiretroviral treatment also. Then in one person still dies from AIDS-related causes every minute. Geographically, while progress is strong in sub-Saharan Africa and Asia, new infections are rising in the Middle East, North Africa, Eastern Europe, Central Asia and Latin America also. On tuberculosis, the situation is alarming. In 2023, 8.2 million new TB cases were reported. The highest number were recorded also. This is 15% higher than 2019 levels, and it also indicates we are losing the ground in TB control. So, in moving on to the non-communicable disease crisis, it represents perhaps the most pressing health crisis of our time. In 2021, an estimated 18 million people under age 70 died from NCDs, accounting more than half of the all premature deaths in this age group globally occurs. Four main culprits are cardiovascular disease, and then which includes heart attack, strokes, and the next one is cancer, and the next one is chronic respiratory disease, that is COPD, and asthma and diabetes. What makes this crisis particularly challenging is that these are largely preventable through lifestyle changes and treatable through medication and healthcare. However, the world is not on track to meet SDG target of reducing premature NCD mortality by one third by 2020. The trend is moving in the right direction, but the risk has been decreased since 2015, but the pace is too slow. Pharmaceutical innovation is critical here. We need new therapies for cancer, cardiovascular disease, and diabetes also. We also need to increase the availability and affordability of existing essential medicines from a pharmaceutical perspective. This is where the drug development, production efficiency, and sustainable supply chains become essential. The challenge is just isn't creating new drugs, it ensures everyone everywhere has to access them. Uh, our next one is universal health coverage means everyone can access quality health services without facing any financial hardship. However, UHC remains a distant dream for the billion of peoples. Let me present the stark reality. 344 million people were pushed or further pushed into extreme poverty in 2019 due to the out-of-pocket payments for healthcare. Imagine of having choose between buying medicine for your child or buying food. Millions of people face this decision daily. Coverage of essential health services varies dramatically by wealth, education level, and location also. In low-income countries, coverage of reproductive, maternal and child and adolescent health services is also highest among the wealthy, educated and urban populations, while the poorest and rural population lag far behind. This inequity is unacceptable and directly contradicts the SDG principle of leaving no one behind. And then moving on to the pharmaceutical innovation role, the pharmaceutical industry plays an indispensable role in achieving SDG 3. Let me outline the key contributions. First, research and development is fundamental. Pharmaceutical companies invest billions in discovering and developing new medicines for diseases that primarily affect developing countries, diseases that might otherwise be unprofitable but are critical for global health. This R&D pipeline includes vaccines, antibiotics, antiretrovirals, and therapies for neglected tropical diseases. Second one is vaccine development has demonstrated remarkable agility. The COVID-19 pandemic showcased the industrial capacities. Like mRNA vaccines were developed, tested, and deployed less than 1 year. This same capability is now being applied to other diseases like RSV and influenza. Third one is addressing antimicrobial resistance. It is a major pharmaceutical priority because it is a silent pandemic one. Resistant bacteria, virus, and fungi are causing infectious that drugs can no longer treat. We urgently need new antibiotic and alternative like phage therapy. Fourth, digital health integration, transforming the industry also. So vaccine coverage decline. One of the most concerning developments in recent year is the sharp decline in childhood vaccination coverage for post COVID-19. This is a critical setback for SDG 3. Between 2020 and 2022, childhood vaccine coverage stagnated or declined for most vaccines. Specifically, the coverage of DTP3, which serve as a barometer for overall vaccination system functionality. It had not been restored to pre-pandemic 2019 levels even by 2023 also. This means millions of children remain vulnerable to diseases we can prevent with vaccines. The Immunization Agenda 2030 sets a global target of 90% coverage for all the key childhood vaccines. However, if current trends continue, this target is unlikely to meet for any of these vaccines. Why does this matter? Because diseases like measles, polio, and whooping cough thrive in under vaccination populations, and we have already seen outbreaks in several regions. The pharmaceutical industry, pharmacy professionals must collaborate to rebuild vaccination confidence to improve vaccine distribution systems and ensure equitable access. The next one is sexual reproductive health progress. Excellent progress has been made in reducing the adolescent pregnancy rates. The global adolescent birth rate among girls aged 15 to 19 has declined. You can see in this PPT or in the slide from 66.3 to per thousand in 2000 and 38.3 per thousand in 2024, and it is projected to decline further 34.8 by 2030. Mental health and substance abuse has emerged as a critical component of SDG 3, especially post-COVID, which exacerbated global mental health crisis also. Target 3.4 specifically includes promoting mental health and well-being as a part of reducing premature mortality. WHO estimates that 1 in 8 people globally experience a mental health condition. Depression and anxiety disorders are among the top causes of disability worldwide. Yet, access to mental health treatment is severely limited. In many low-income countries, there is one psychiatrist per 1 million people. Pharmaceutical treatments for depression, anxiety, bipolar disorder, and schizophrenia are essential components of mental health services. However, we must emphasize that pharmaceuticals alone are not sufficient. There must be integrated with psychological support, counseling, and rehabilitation. Target 3.5 addresses the substance abuse. It includes both illicit drugs and harmful alcohol consumptions. The pharmaceutical approach includes medication-assisted treatment using drugs like methadone and buprenorphine for opiate addiction and naltrexone for alcohol use disorders. However, the coverage of treatment intervention remains in a decade globally. For pharmacy students, this represents an important area where you can directly impact patients' lives by providing counseling, monitoring, and side effects, and enduring medication adherence also. So target 3.9 addresses an often overlooked aspect of health, disease, deaths and illness from hazardous chemical and pollutions. Air pollution remains a leading environmental health risk globally, it causing a premature death primarily through the respiratory and cardiovascular diseases. Water and sanitation related diseases still kills hundreds of thousands annually, particularly in low income countries. Chemical population from industrial resources, pesticides and improper waste disposal contributes to the various cancer and neurological disorders and reproductive health issues also. So, with 5 years remaining until 2030, we must accelerate efforts across several fronts. First, we have to strengthen health system in fragile and conflict affected regions. These areas experience the worst health outcomes because healthcare infrastructure is disrupted or absent. The UN and WHO and international organization must provide technical and financial support. Second, the scale up vaccination coverage urgently. We need coordinated global effort to rebuild vaccination programs and address vaccine hesitancy and ensure equitable access. Pharmaceutical companies must ensure adequate vaccination protection through and supply the chain resilience. Third one is we have to accelerate R&D and non-communicable diseases therapeutics. We need better drugs for cancer, cardiovascular disease and diabetes. We also need to continue focus on neglecting topical diseases that disproportionately affect the poor. Fourth one is we have to recruit, train and retain health workforce like doctors, nurses, midwives and pharmacists. This requires investment in education, competitive salaries and career development also. Fifth one is we have to ensure affordable and quality medicine access globally. This involves addressing the pricing, intellectual property flexibilities and building a local pharmaceutical manufacturing capacity in low and middle income countries. So as we conclude, I want to emphasize that achieving SDG 3 requires unprecedented collaboration across disciplines, sectors and nations. Pharmaceutical expertise, whether in research, manufacturing, distribution or patient counseling is absolutely central to this mission. Healthcare professionals, including pharmacists, are not passive observers, you are active agents of change. Every prescription counseled, every patient educated about medication adherence, every innovation in drug delivery or green chemistry, every advocate speaking out for a health equity. These actions collectively move us toward goal, and the system must work in partnership to ensure the innovation reaches those who need it in most. We must design the medicines for poverty related diseases, not just profitable ones. We must ensure that affordable access, not just for the wealthy. We must prioritize local manufacturing and capacity building in developing countries, and we must do all this while protecting the planet. The vision of health for all by 2030 is ambitious but achievable. It requires commitment, investment and innovation. Qualities the pharmaceutical community possess in abundance also. Thank you for your attention and your commitment to this vital goal. Thank you everyone.